Streamed.
Praise the Lord, women of Apostolic Church of God, Sisterhood Connection, those who are joining from other churches and invited guests. My name is Karana Mason. The Health and Wellness Leadership Team would like to welcome you to your May 2023 Health and Wellness Series. We would like to acknowledge our pastor, Dr. Byron T. Brazier, our First Lady, Evangelist Mary Brazier, the moderator of the Sisterhood Connection, Kelly Medius, the Health and Wellness Leadership Team. Let us pray. Dear Heavenly Father, we thank you for allowing us to come together this evening to fellowship and to learn how to take care of the wonderful temple that you've given us. Open our hearts and our minds to receive the information that we need. We worship you, we praise you. In Jesus' name. Our theme is being good health. This is from 3 John chapter 1, verse 2. Beloved, I pray that in every way you may succeed and prosper and be in good health physically, just as I know your soul prospers spiritually. If by chance you missed last week's topic on mental health presented by Genesis Hall, you can view it on our social media platform. Today's topic of our health and wellness series is foot health, presented by Dr. Lashawn Freeman Whittaker. Dr. Freeman Whittaker is a podiatrist and business owner for over 20 years. She is a graduate of Fisk University, Boston University, and the Dr. William M. Scholl College of Podiatric Medicine. Dr. Freeman Whittaker completed her residency at John H. Stroger Junior Hospital of Cook County. She opened a private practice in Hyde Park, where she met her future husband, Pastor Curtis Whittaker Sr. of Progressive Community Church in Gary, Indiana. She later moved her private practice to Indiana, where she currently resides with her husband and her son, Curtis Jr. Dr. Freeman Whittaker is the founder and CEO of Emerge, Inc., an empowerment and mentoring training program designed for women from all social economic backgrounds to reach their goals. She also works with her husband and several church volunteers to lead Faith Farm Partnership, growing sustainable food and with urban farmers in Gary, Indiana. Welcome, Dr. Freeman Whittaker.
Thank you, and thank you. Thanks so much for this lovely invitation. I was totally surprised and just tickled pink because Dr. Corona Mason was my instructor. I remember the very first day. Oh, she got the sweetest smile, but she does not play. I appreciate you, Dr. Mason, for making us great. We got it. Was it biomechanics? That course was just, oh man, a pain in my side, but you make sure we got it. I thank you for that. And it's such an honor and a pleasure to be presenting with this wonderful body. I do want to acknowledge this great pastor, the First Lady, Dr. Hayes, everyone who helped make this program such a success and much needed effort. I do not want to miss anyone's name, but everyone involved, thank you from the bottom of my heart. It is such a pleasure to be here this evening. And thank you everyone for joining in on such a prevalent topic, foot health care. We do want to keep our temples healthy and well as unto the Lord. And I truly believe in God wanting that so much for us as he created us fearfully and wonderfully made. I'm so thankful that, okay, something happened. Did I get kicked off?
I can hear you.
I can hear you.
Okay. I'm not for sure what happened to the screen. I'll try to get it back.
Now you're back.
I'm back. Okay.
Yes.
All
Do you
right.
need
Thank
Dr.
you.
Hayes to pull up your presentation?
Thank you. Sorry about that. Foot health. We want to talk about foot health this evening because as women, this is such a prevalent topic for us. I believe if we can advance the slide, I would love to share with you some very important steps and topics of basic foot health care is so important to our bodies. Generally, majority of people who come to see a podiatrist are really having trouble with the quality of their life. When your feet hurt, it's hard to really be active in life. It's hard to ambulate. It is hard to feel great. It is very hard and difficult to exercise. It's difficult to be productive on your job. Foot health care, I cannot underestimate how important it is. I remember the first day when I said that I'm going to be a podiatrist, people laughed. They're like, oh, what in the world is that? But I'm so grateful that God has allowed me to be able to use my hands to help our society become more healthy when it comes to your feet. Basic care is so important. A lot of people struggle with basic care of their feet. For example, corns and calluses, the fungal thick toenails, which can lead to more severe issues such as ulcerations, such as inability to wear the proper shoes. We always overlook our feet. A lot of our society are diabetics. A lot of people in our communities, especially African Americans, struggle with diabetes, hypertension, and obesity, which is directly related to your feet. And what I always like to do with new patients, for example, is to sit down and discuss what common chief complaint that they're dealing with. Basic health. Your feet is connected to your body. For example, what we eat makes a big difference in our entire body, our health, which in turn does affect your feet. For example, we mentioned diabetes earlier. The average diabetic patient will at some point experience numbness, tingling, burning sensation, which we call neuropathy. Diabetic neuropathy does eventually make people sometimes lose the sensation in their feet. When you lose sensation in your feet, you're very susceptible to stepping on objects that you're unaware of. For example, if you do step on an object, a diabetic may or may not feel that until they smell an odor or until someone in their family sees a bloody discharge on the sock. Again, it goes back to basic health care. Are you exercising? How is your diet? How are you eating? Are you consuming water? So overall, one of my primary roles is to not only talk about foot health care, but our wellness in general. Your diet matters. Thank you so much for the slide. I really appreciate it. Next slide, please. So thank you, Dr. Hayes. That's a basic introduction to important health. And my job is to maintain your foot health in a very obtainable way. Why is it important? We're going to keep it very simple. I'm sure many of you may have your reasons for why you think your feet are important or you want to keep them important, because you should. As women, a lot of us, I'm sure you love to wear the high heels. You love to exercise. You love to be able to go on about your day. So those are things that I want to help every individual with in their life. Not only that, next slide, please. Are we able to? Oh, great. This is good. Okay. Your feet are the foundation of movement, making good foot health essential for your balance and injury prevention. We talked about that. Your feet are necessary for being independent. That's very important because who wants to be sedentary when you're not able to walk, you're not able to get around your day? That is a miserable way to live a quality of life, because we want to keep your feet healthy because it's the basics of your body. It's very vulnerable to stress and strain. And we mentioned obesity. The more you weigh, the more strain it is on your feet. So I get it. We all struggle with keeping our weight down, even myself. But that's very, very critical because of the weight. It stretches your ligaments. It stretches the fascia. It creates more potential for bunions to form, bunion deformities, hammer toe deformities. Those are very, very painful also. If you look over to your left, it says this: your foot health can be an indicator of your overall health. We talked about the diabetes. We talked about the circulatory disorders. All of those things matter. So keeping yourself intact is very critical to improve the quality of your life. Making good choices matter. Next slide, please. Great. Thank you, Dr. Hayes. So basically, I'm not for sure how many of you have really seen the anatomy of your foot, but I thought it's pretty cool. Your feet have a lot of bones in it. One foot, I believe it says like 26 bones. That's a lot. If you look over here, just briefly, we're not going to get too thorough with it, but you can see all of the muscles, the ligaments, the tendons, we call the toes in a medical world phalanges. You can see the phalanges, and from there, the metatarsals, the tarsus, and it goes on up from there. Such an intrinsic area. Your foot is very delicate, very, very detailed. So again, unfortunately, it's a part of the body anatomical wise that goes overlooked. And it shouldn't be that way. It should not be that way at all. Any questions? Are we taking questions now or at the end? I'm not sure, but
We can take them at the end.
At the end, okay. Thank you, Doc. If anyone has questions about this diagram later, please feel free. I would love to go over it some more with you. But this is just how your foot looks. It's amazing. Next slide, please. Thank you. Common foot problems. I'm sure, okay, let's get into it. Common foot problems: corns, calluses, athlete's feet, blisters. We see these on a daily basis. I'm not for sure. I don't think I put a fungal toenail there, but the main basic problems on an everyday clinical day, I would see corns, calluses, hammer toes, fungal toenails, blisters, ulcerations. These are real patients. These are real things that walk through our doors every day, every day. Not only that, again, I'm just going to emphasize basic hygiene. A lot of elderly patients have such a difficult time reaching down, putting on creams, oiling their nails, or even bathing. So if you have difficulty with those areas, it can lead to severe dry skin, cracked skin, which leads to fissures or very deep areas in your skin. It can also lead to, incurable calluses and corns, which makes it very hard to walk. So applying the proper moisture to your skin matters. I'm not a fan of Vaseline. I know a lot of people get a lot of pushback on that. I get it. I grew up with Vaseline, but to really create the proper moisture that you need in your feet, I prefer more creams than lotions. Next slide, please. Thank you so much. So let's talk about how do we prevent a lot of foot problems. Prevention is the key to maintaining good health. as we mentioned, some of the tips, again, we go back to hygiene, proper foot care, avoiding long periods of standing or walking in ill-fitting shoes. I'm a big fan of high heels. I love my heels. And a lot of patients ask me, oh, doc, tell me the deal with these shoes. Are they good or are they bad? I always say use common sense. If your feet start to hurt, of course, take the shoes off. Always carry a more comfortable pair of shoes so that your foot isn't cramped or isn't really creating swelling. So I would say modification is the key. Using common sense. Sure, you can still look stylish and fabulous in your high heel shoes. At the same time, just if your feet are hurting, I would avoid just continuing to keep those on and ambulating in those on a daily basis. Next slide, please. Thank you. Shoes, shoes, shoes. I always start with shoes with patients who are struggling with deformities in their feet, such as hammer toes, bunions, or even neuropathy. Even if you do not have deformities, these rules and tips still apply to you as well. How do you search for a great fitting pair of shoes? I tell my patients, just spend the extra $20, $40, $50 on a pair of shoes that are good quality, because if you continue to buy the lesser cost shoes, they sometimes can not be the best fit or the best quality, which can lead to a lot of rubbing and bruising on your feet, which can create blisters, calluses and corns. So if you're not able to purchase a good pair of shoe or a good brand, just save your money until you're able to get a good pair of shoes. So shoes are very important. I believe people are changing the way they view their feet now. I truly believe podiatrists are making a big impact, a huge difference in our world today. We are educating people, helping them keep their feet healthy. I'm all about salvaging limbs. I tell my diabetic patients, even non-diabetic patients who unfortunately do need amputations, because if sometimes they may have worn the wrong type of shoes, which may have led to a blister that they did not catch in time, which may have led to gangrene, therefore needing to be removed from the area. So we go back to the basics again. Shoes, shoes, shoes. Spend the extra money on it. You won't have any issues, hopefully. Next slide, please. Thank you. Foot exercises. I like this because, again, as we gracefully age, sometimes arthritis and stiffness can occur. You want to exercise not only your foot, but also your entire body, because you want to stay flexible as possible. A lot of my patients have limited range of motions. As I mentioned earlier, when I was introducing myself, speaking of how Dr. Mason was our biomechanics instructor at the time, but the biomechanics of your foot really is important, because you want to be able to have as much range of motion as you can, full range of motion as you can. However, when your motion becomes limited, it creates a lot of arthritis. It creates a lot of stiffness. You're not able to walk, move your feet. It is so miserable to live a life like that. So my advice, exercise, exercise, exercise. Even to get up in the morning, you can stand up on your toes, up and down, flex them. I'm a big fan of yoga and Pilates. I like to stretch. Stretching is very important. So if you're listening today, keep your body flexible. Next slide, please. Thank you. Foot massage. Oh, this is a very good one. Foot massage. I know so many of you, I'm sure, do go get massages. And I'm sure it feels so amazing when you do have a great foot massage, because why? It helps improve circulation and it can relieve tension in your feet. I tell patients today that a lot of us overlook massages. We're busy. We don't really quite have time to get in or whatever it is, but always try to get a great foot massage. Even if you do get a pedicure, I'm sure it feels great when they're massaging it and getting the circulation going in your body. It makes a huge difference. When patients are in my chair, I try to massage it so the circulation, the blood flow can become better in their feet as well. Next slide, please. Thank you. Let's talk about next some common foot injuries. Unfortunately, injuries do occur, and a lot of youth, a lot of children, adults, whatever your situation may be, have injuries. A lot of athletes come to my office via basketball, soccer, track, football with broken toes, broken ankles, and that may require a need to be taped or strapped or cast or even surgery at some point. So try to be very careful to avoid injuries as well. If you do, for example, a lot of my patients, they run marathons or they're doing a lot of weight-bearing activities that create a lot of tension and shock absorption on their joints, which can lead to tendinitis. I'm sure a lot of us have experienced tendinitis before, which is basically inflammatory response of your soft tissues and your ligaments and your muscles, which can create difficulty ambulating as well. If that is the case, please see your podiatrist. The basic things you need to know is RICE, the rest, the ice, compression and elevation, and always get to an emergency room or care provider immediately. Next slide, please. Thank you. Thank you. Well, as you know, as podiatrists, we are able to treat your foot injury very appropriately. What I do for patients, of course, after the presentation, depending on the assessment, we go right into immediately the RICE method, as I mentioned.
Dr. Freeman Whittaker. She must have gotten kicked off.
Yeah, I don't hear anything from her. Well, just put your questions, start putting some questions in the chat, everyone, while we're figuring out.
And I can also add while we're waiting for her, since I am a practicing podiatrist as well. In terms of the injury piece, I was taking notes as Dr. Whittaker was talking about things in terms of questions I would ask her. But for injuries as well, something that I used to see in my practice, a lot of times you may feel like I have a pain in my foot or a cramping, and you say, oh, it's going to go away. I don't have to worry about it. Anything that persists after 2 days, my recommendation is to see someone, because what happens is by the time you get into the office, if it's been 2 weeks, 3 weeks, it takes that much longer to treat. Even something as simple as heel pain or plantar fasciitis, and kind of inversion sprain. Sometimes when you sprain your ankle, it doesn't mean that you've broken it, but it could mean that the ligaments are torn. And be quite frankly, for me, healing a sprained ligament can be take as long to recover as an ankle in a way, because the tendons take a long time to kind of readjust. So what I've seen as a problem a lot of times when people do injure their foot or their ankle is that they kind of wait and walk on it, and it swells, and then it really takes a longer time to gain full recovery of that limb. Dr. Hayes, can you go to her next slide until she gets back on? I'll just do her presentation. Oh, okay, great minds think alike. And she said, when do you see a doctor? When do you seek medical attention? And, as I said it, great minds think alike. As soon as you have some type of issue, and I would say past 2 to 3 days, it's best to go in. As she has on her slide, early intervention is very important. Sometimes you can go into urgent care. Sometimes you can just see your primary care physician. Some of the foot deformities, your primary care physician may give you, anti-inflammatory, and they may give you a referral, or they may say, come back. What I would do, depending on your insurance, if you can go straight to a provider that can assist you with that, that's what I would do. Okay, next slide.
I'm back on. Hello.
All right, I just did when to see a doctor. Okay, so you can take it from.
Okay. Oh, so I apologize. I'm sorry. I had to hop in my car because my battery died. I'm gonna be honest. Okay. Thank you. So thank you so much, Dr. Mason. Went to see a doctor, and I did hear Dr. Mason mention that you said 2 to 3 days. Is that correct? 2 to 3
I
days.
just said that, yeah, if you have pain 2 to 3 days after, it's best to start seeing someone.
Absolutely. Please do not ignore it. I make a strong advice to never ignore the pain, because it could be nothing, but always check to make sure that everything's okay, because the sooner you address it, the better the outcome. Next slide, please. Thank you. Oh, wow. Conclusion. Okay. In this presentation, we've discussed the importance of foot health, common foot problems, and ways to prevent foot injuries. I just want to end by leaving you with the basic important care of good foot health. Please do not overestimate or underestimate anything when it comes to your feet, because that is the basics of your body and the foundation. And once you create a wonderful foot health, it's just amazing lifestyle that you can always have, and you're more independent and you're enjoying life. I want to thank everyone again. I'm really excited to get questions from you as we continue to talk about foot health care.
There's one question, any recommendation where to get a good foot massage was one of the questions.
Oh, that's a good one. Well, you can always come to, can I say it, Dr. Mason? The new salon?
Well, you say whatever, yeah. You could.
Okay.
Yes.
Good question. Listen, I do want to make a recommendation that we open a addition to my private clinic. We offer massages, manicures and pedicures, CBD oil soaks for customers who are seeking some relief. So it's in Gary, Indiana. It's called Nailed It Med Spa by Dr. Lashawn Freeman. And if you want more information, you can always go to our website at freemanfootcare.com as well. Someone asked, what creams do I recommend? Oh yeah, so they heard me say Vaseline. Oh no, I'm in trouble right now. So, all right, here's the deal. Creams, my preference is a great cream. I start with, if you want a cost-effective cream, shea butter is amazing. The original raw shea butter is such a wonderful organic natural cream for your body. And I think most people can't afford that. If you want to get real fancy with it, you can buy more, organic moisturizer creams. But just to get to the basic, I would just stick with the shea butter. Shea butter is amazing.
Can you adjust your camera a bit? They can't really.
Oh, yeah. Yeah, exactly. Is that better?
Perfect. Oh, beautiful.
Okay. Sorry about that.
That's okay. Do you mind? Okay, what about vapor rub for the foot? That's a great question. What about
Oh,
that?
that vapor rub. Absolutely. I think it's a great, analgesic. It's old fashioned. I remember who doesn't have a jar of that in their medicine cabinet, Vicks vapor rub. Green alcohol. A lot of individuals like the green alcohol Vicks vapor rub to help with the circulation. Is that where you're asking circulation or antifungal properties? Some people say it does have antifungal properties as well, but absolutely, I'm a fan for that.
Okay, vapor rub. I don't know if it's for moisturizing or just for analgesic. I'm not quite sure.
Analgesic.
Yeah, moist analgesic. Then okay. A question. I mean, something I wanted to ask about was melanoma in African Americans.
Oh, melanoma.
Yeah. Because and I don't know if everyone knows this, but Bob Marley actually died of malignant melanoma. It was in his, and then it spread. It became metastatic. So I know African Americans don't think that we can get a melanoma because of our skin color. You want to talk about the frequency of that in African Americans?
Oh, I'm so glad you raised awareness to that, because I'm sorry, my phone is charging on my dashboard, please. But when we see dark spots on the foot, I used to say, oh, it's nothing. Oh, it's a freckle or it's a mole. And that's the tricky part about it, because people think it's just that, a mole or a skin tag. But now, whenever there is lesions on your foot, I like to, number one, either biopsy it or refer to a dermatologist. Unfortunately, melanoma is being diagnosed more. We're catching it more because, again, it was just overlooked as though, oh, it's just a pigment, it's just a spot. And a lot of times it does not hurt. It's just there for many, many years until it's too late. And then when it's too late, of course, as Dr. mentioned, the Bob Marley situation, and it's unfortunate, but it can happen. So we always try to be very, very aggressive, very much proactive and preventative. A lot of patients will say, oh, it's just nothing. So once I get them to realize, hey, it could be nothing, I'm praying and hoping that it is benign, but let's just make sure it's not malignant. And once they go get a biopsy, I've seen a whole lot of things. They'll say, Doc, you were right. I cannot believe that this was on my foot. So there you go. It's better to be safe than sorry. Absolutely. Good question.
So another question is there a way to correct thick toenails?
Oh, it's so hard. There are different degrees of thickness. So I like to classify the toenails. Some are mild, moderate, and severe. The more mild, for example, slightly stained, slightly yellow, not as thick, they might have a better chance, if you're more in the mild category, a better chance of maybe an antifungal tablet, maybe is, I believe, less than 50%, right, Dr. Mason, of clearing it up.
At minimum. Now it's down to
minimum.
50%.
Yeah. There is so hard. It's so hard. It's very, very hard. Once that fungus is infected into the nail bed, it's just hard to reverse. But I like to hear Dr. Mason, because that's the big question. I get that asked about 10 times a day.
So the first thing that has to be done with thick toenails is you need to have a practitioner to really decide whether it's fungus. More than likely it is. And then, if they take a scraping of it and send it off, then you can figure out, what type of fungus it really is. Because a lot of the medication that's out there, that's prescription medication, that's indicated for fungus nails, only work maybe 33% of the time successful. It's just not, there's nothing out there that can eradicate it totally. I think the percentages were better 20 years ago than now, but yet we've got more medication. There is an oral medication, the oral terbinafine, that works for certain fungi, not for a lot of them. So again, Dr. Freeman Whittaker talked about biopsying of lesions, also taking a sampling of the nail, which we're calling it a biopsy, and sending it off so they can figure out what it really is. Sometimes thick and darkened nails could be mold or something else. It doesn't necessarily have to be fungus. I would say 80% of the time is, but to answer that question, I don't believe there's anything that can totally eradicate it. The only thing that is close to that is oral medication. It's oral Lamisil, but there's side effects to that. So definitely you need to talk to your healthcare provider, and I would say a podiatrist for this, because this is something we deal with on a regular basis, and find out what's the best treatment for you so that you can have adequate expectations of what your nails will look like. So I don't think it's an answer that's a great answer, but it's the best one we can give you at this time. Dr. Whittaker, can you talk about how the connection with the knee and the foot from an athletic perspective, when people are exercising and all of a sudden they have knee pain, right? But actually it's a foot problem.
Absolutely. There we go. Back to the basics. As they always say, your foot is your foundation. And that is so true. It is so true. What I'm seeing more and more now is more younger people, Dr. Mason, is being affected by severe flat feet, where they're literally just about walking on the ankle because the foot is turned so much inward, creating what we call posterior tibial tendon dysfunction. It's just unbelievable. And it's so unfortunate to see when you're that young, because you're active, you want to play sports, you want to get involved with track, basketball, whatever it may be. However, it's very, very difficult to perform anything, especially on the field, when the foot is flat or hurting, in terms really does affect the knee as well. Knee pain, foot pain, leg pain, the entire lower extremity becomes affected by your foot structure, proper structure. As we mentioned, flat feet. I think all of us know what flat feet are. Some flat feet are very, very severe, which means you need to position it back into a proper anatomic position, more parallel to the floor. We call it, did I say it right? What's the word? Plantar flex, not plantar flex. But when it turns outward, that means you're in trouble. Okay, when it's turned inward so much so we want to bring it back up to neutral in an anatomic position. Pronated, that's the word, pronated, I'm sorry. Pronated. You bring it back to neutral pretty much. And my recommendation is custom orthotics. They're very, very expensive. However, it's so worth it. Very worth it. Dr. Scholl's, I believe, made it very famous of the over-the-counter orthotics. A lot of people pick those up and put them in the shoe so they can get more shock absorption, so the foot can come up off the ground more and make their, mobility better and the knee feel better. So when your foot is out of proper position, it does affect your knee because your knee turns the same direction as the foot. So important. Foot orthotics, the shoe, everything makes a big difference in your body. Not only the knee, but the hip and the back. Absolutely. If we want to be honest, the entire spinal cord, the entire structure, your posture, everything, it makes a big difference. So I just strongly advise individuals to get some orthotics if needed.
Yeah, if you have knee pain, if you have back pain, absolutely, we'll throw it out of alignment. We've got a couple more questions. Let's get to it.
Yes.
Okay. What about corrective shoes? And I'm not, What are corrective shoes? But do corrective shoes work on hammer toes? Do they fix hammer toes? Is the question.
No, I don't
Yeah, they
think
really
so.
don't. Yeah, I know. And I didn't want to contradict you, but yeah,
I
corrective
know.
shoes don't really help hammer toes. If
No,
it has a high toe box, meaning the
maybe
toe, it will help it, but it doesn't correct it. That's it.
correct.
And another question is for you, what is the rice system?
Good question. Right.
When you talked about rice, how do you,
Yes.
what do you do for that? I guess what is rice?
What is rice? Very good question. Rest. You want ice, meaning rest. Rest is what it is. Rest. Get off of it. Elevate it. So rest. The R means rest. Ice compressions. Okay. C. The letter C stands for compression, which means you want to apply an ACE wrap, a bandage, something to reduce the swelling from the injury. And the E is elevation. Prop it up, stay off of it. Crutches, but pretty much elevation. Pillows, a lot of people apply pillows under your leg to keep it up as well. So that's an acronym. It stands for RICE. Rest, ice, compression, and elevation. Good question.
Okay, we have another question. As a diabetic, can I go to the nail shop to get my toes done? Or should I stay with the podiatrist to take care of my feet?
Wow, that's a really good question. I say be very careful. Be very, very careful. Do you want to go to the nail salon? Yes, you do. However, if you do go, if you are a diabetic, I always educate my diabetic patients, number one, bring your own instruments, okay? Don't be embarrassed. Don't feel as though you have to apologize on why you're asking the nail technician to use your set of instruments. Number one, it keeps your foot from any risk of getting infections, okay? Bring your own nail set if you can. Your nail file, bring it all. Your buffer, your nail file, all of those things help reduce the risk of infection. Well, you take a risk anyway as you walk in, but you're just trying to reduce it as much as possible. Can you get a pedicure? Yes, if you're diabetic, of course. So just be careful. I would not let them pretty much clean the cuticle excessively or grab tissue or try to go deep in the nail. Keep your nails square, light exfoliation. Please let them know that you are diabetic, and so that way they're more aware of not doing too much or going too far with your skin. But I think you can. Just be careful. Sure.
What about if you're diabetic and you have a diabetic neuropathy?
Can you get a pedicure if you're diabetic
Yeah,
with neuropathy?
if you have a neuropathy. What's your thoughts on that?
I do have mixed feelings. So this is what I always tell my patients. In my belief, I would say, yes, you can. Be very careful. I have a medical spa. The thing about it, you have to make sure that the technician is trained with diabetes. I wouldn't just go to anyone. I wouldn't go to just any other shop, but there are medical trained nail specialists out here. So you have to do your research. If you are diabetic with neuropathy and do desire or want to get a pedicure, make sure your technician is trained.
We do have questions from Facebook and ACOG Plus.
Yes. Hi, everybody. We have a couple of questions and comments from Facebook. Samanita Armstrong wants to know, is soaking your feet in Epsom salt okay?
If you're diabetic, no, you know what? They say I would not do it because Epsom salt contains salt, of course, and it does, apparently it can swell your feet. What do you think about that, Dr. Mason?
You can tell she was my student, right? Because she can't help it, y'all. She definitely.
I'm like, am I right?
I was her professor, so yeah, I agree with you. I think Epsom salt can be overused in that it just, I don't know, harm it, but it can cause swelling.
It can.
Oh, you may now think that your foot's swollen, but you used Epsom salt. So, I mean, injuring it even, I think we've kind of gone away from Epsom salt. I agree with you, Dr. Whittaker.
Okay.
And Antoinette Martin wants to know, what would you suggest for a person that has hammer toes? Her friend suffers from that ever since she was a little girl. So what are your suggestions for that?
Well, it depends on the patient's desires. It depends on if they're wanting to have it corrected or not.
Okay.
The hammer toes, basically, if you want them straightened out, that is a surgical procedure, period. There's no other way that your toe will become straight without surgery. Now, I know people who go by toe separators or the toe pads and devices to help the foot become straight. But once you take that padding or strapping off, it goes back to the contracted state of the hammer toe. So essentially, it just depends on the wishes of the patient if they want surgery to get it straightened out or stick to conservative care.
Okay, I got 3 more. Sister
Yes.
Lenora Welsh says, I'm enjoying this topic and I'm learning a lot about my feet. My question is, I am having problems with my ankles. Is there any type of socks I should be wearing to protect them?
They're copper. I believe a lot of people like the copper tone socks. Compression socks, I'm not for sure, but the compression socks help a lot with the swelling. The copper tone, they say whatever ingredients in it kind of helps with the swelling, the sensitivity, neuropathy, and things of that nature as well. But good luck.
And then Yolanda Williams says, are you accepting any new patients?
Yes, we are. Thank you, Ms. Williams. My practice, again, is located in Northwest Indiana. It's not too far from Chicago. About 25 miles, I believe, but yes.
Okay, great. And then Jean Wright says, what about witch hazel?
Witch hazel for, I'm not for sure. I really don't know anything about witch hazel. Is it more an astringent or?
She didn't say.
It's over the counter now. It's over the counter. And I mean, other than it, if it's soothing for you, yes, but it really doesn't have any medicinal properties as it relates to foot pain or tendonitis or anything of that nature. But if you're feeling better if you use it, okay, then continue. But it really doesn't, it's over the counter and it really doesn't have any true medicinal properties. I mean, sort of like maybe Neosporin or something, you know what I mean? It helps, but it doesn't help. That's my thought, Dr. Whittaker. I'm sorry, that's the top of my
No, you're good. I had to think about witch hazel. Wow, that's a good one. I hadn't heard of that in a long time. But as you mentioned, I agree with Dr. Mason, if it helps and makes you feel good, absolutely. A lot of people now are using more essential oils, though, like the eucalyptus, the rosemary, the mints. If anything, I would probably redirect my options in terms of more of the essential oils. So lavender, rosemary, and the eucalyptus. So those are good. They're good for circulation also and making you feel more comfortable.
Thank you from the bottom of my heart. It is such a pleasure to be here this evening. And thank you everyone for joining in on such a prevalent topic, good health care. We do want to keep our temples healthy and well as unto the Lord. And I truly believe in God wanting that so much for us as He created us spiritually and wonderfully made. I'm so thankful that
Okay. It is 6:49. I don't know. Oh, good. Her address is in the chat in terms of her office number, where you're able to make an appointment if you're interested in seeing Dr. Freeman. Also, if anyone has any more questions, I can answer them. And if not, we can prayer and close out. And I just have some reminders.
Now you're back. I'm back. Okay.
Oh, okay. Any more
Thank
questions?
you for my presentation.
Any more questions?
Yes, what is her contact? I'll put in a chat all around.
It's in the chat now.
Sorry about that.
That's okay. They just wanted to know your information, and it's in the.
We want to talk about foot health this evening because as women, this is such a prevalent topic for us. I believe if we can advance the slide, I would love to share with you some very important steps and topics of basic foot health care is so important to our bodies.
I don't know what just happened. It sounds like it's the recording is like
It's the recording.
It's looping.
Podiatrists are really having trouble with the quality of their life. When your feet
I don't
hurt,
know what happened.
it's
either.
hard
Sam, is there any way you can stop that? Okay, look like he did. And we did get the information and put it in the chat. Thank you for asking for that, Michelle. And Karana, if you don't have anything else you want to share, since you guys were kind of tag teaming one another, this was awesome. Yeah, so this is one of our own people. She is also gifted and talented, educated, and she's a trainer, and she gets all these people prepared and ready to take care of people's feet, and she does too. So is there anything else you may want to add? And then
yeah, I have nothing else. If no one else has any other questions, I can just start closing out. I just have some reminders, some housekeeping things I want to mention. If you were not for next Thursday, I hopefully, we can, get folks in next Thursday, May 18th at 5:50. The next health topic will be nutrition, which I'm sure is going to be very interesting to everyone. And the presenter will be Kimberly Howard Shores. Also, please plan to be in attendance for the All Things Fitness event as we culminate the wellness series with an in-person experience on May the 25th at 6 p.m. That we would like for you to register. You can go to the Sisterhood Connection page or use the QR code. I really appreciate everybody coming, and hopefully you find this very helpful for you. If nothing else to be said, I can pray out and we can dismiss. Okay. Dear Heavenly Father, I just want to thank you again for allowing us to be present this evening, allowing us to fellowship, allowing us to get information that, again, will make our temples better so that we can go forth and do your will. Keep us safe, have us wake up tomorrow in our sound mind and with good feet. I ask this in the name of Jesus. Ladies, thank you so much for attending. If there are any males, thank you for attending. So I will see you at the next wellness series.
Press it up. Yes, keep moving. Ladies, May is Women's Wellness Month, and the Sisterhood Connection has prepared a great wellness section for all things fitness for you. I encourage all women to participate in our virtual wellness session every Thursday in the month of May, beginning at 6 p.m. Invite someone, join the conversation. We will share information on mental health, foot health, nutrition, and fitness. And on Thursday, May 25th, I will be facilitating a hybrid physical fitness session in the banquet hall and online. If you plan to participate in person, register by scanning the QR code or visit the website and go to event registration. Come ready to work. Wear your loose-fitting clothes, your gym shoes, bring 2 water bottles, and as always, consult your physician before beginning any workout plan. Can't wait to see you, and let's stay in good health. All right, ladies, how you feeling? Come on, give me 3 more. All the way up.